This schematic here and the next one just tells you a little bit about the components of the support package. You will see that it's got three main elements. It's got an organizational diagnostic, it's got a thing called action learning, and an element called training. And underneath the diagnostic and the action learning, we talk about support consultancy and we talk about an online forum. I'm going to tell you a little bit about each of those in the next few minutes. And I'm going to start with this slide, because one of the questions that people say is, okay, you know, I really want the money, I know I've got to do this, and it's probably going to be helpful, but how much time is it going to take up? How much of my time, how much of our organization's time is it going to take up? Well, this gives you an idea, as you can see there, with the time allowance, of roughly the amount of your time in your organization that is going to be absorbed by this activity. Not too onerous, I would suggest. It also highlights which of the two elements are, in a sense, compulsory, and therefore, when you're looking at this, these are the two elements that you need to pay the most attention to and say, is this going to be of value to me? And the first is the organizational diagnostic, and the other one are the action learning networks. The other elements, the training, the support consultancy, here we're going to attempt to provide you with something that's more tailored to your organization. But the organizational diagnostic and the action learning networks have been drawn from the experience of capacity building organizations working in the sector as being the tools that are likely to be of most benefit to the most number of organizations. And it's as simple as that. But of course there will be people here that say, well, we've done that, we've been there, we've experienced that. In which case I would suggest to you maybe you're not going to derive as much benefit from this fund, maybe you're not the best organization to be funded.